Hello and welcome to Living with Allergies. I'm Dr. Polly James, clinical psychologist, and this podcast is a space for sharing the real, lived experience of allergies. In each episode, I'll be talking with a range of people, from healthcare professionals working in the field to parents, young people and individuals navigating allergies in their everyday lives. Together, we'll explore what it's really like to live with allergies, how it can affect day-to-day life, emotional well-being, relationships and confidence. These conversations offer a bit of a window into the therapy room, a reflective space to gently explore and make sense of people's experiences together. We'll touch on things like anxiety, managing risk, and the impact on quality of life, as well as the way people cope, adapt, and find what works for them. My hope is that through these conversations, you might feel a little less alone, find something that resonates, and maybe take away a few helpful ideas along the way. So wherever you're listening from, I hope you can take a moment for yourself as we begin. Hello and welcome to Living with Allergies. So I am Dr. Polly James, and today I am absolutely delighted to be joined by Professor Rosan Meyer. So Rosan is a highly respected paediatric dietitian and professor of paediatric nutrition. She's worked for many years, 30 I think at least, supporting children and families with food allergies and complex feeding difficulties. She's published extensively in this area and has really helped shape both clinical practice in the UK and internationally. But today's conversation isn't about Rosan's professional credentials. Today, we're talking to Rosan as a person living with a food allergy. And in her case, she will tell you more, but a shellfish allergy. And we'd like to explore a little bit more about what that experience has been like across her life. So, Rosan, you and I work closely together as colleagues. We've developed programs for parents with children with feeding difficulties, and we collaborate a lot. But today I'm really excited to get to talk to you about a different matter, a more personal one. I'll try not to be too much of a psychologist, but I would love to start at the beginning, if that's all right with you. Do you remember, or has your parents told you when you first discovered you were allergic to shellfish?
So first of all, Polly, thank you for having me. I feel it's like a therapy session for me. I've never been given the opportunity to really talk about my shellfish allergy to anybody. Especially psychologists. So I remember very well because I grew up on a farm in South Africa. So you have to understand, I was never exposed to shellfish on the farm. My first recollection of shellfish allergy, so that's not of me, was my mom, and I think she was beginning of her 40s, rushing home from a social event and being like red in the face, swollen, and thinking at that stage it was alcohol with shellfish, and she kind of rummaging through where's antihistamines and so on. And, that's more or less where my journey also started, was through my mother, who then turned out to be highly, highly allergic. So my journey really started that as a student, I couldn't afford shellfish, too expensive. As a South African, we were 800 kilometers away from the seaside, came to the UK. And in the UK, so affordable. I mean, you get these £1 big bags of, shrimps that you had, and it was an affordable protein. So I started to have it very frequently. And my first recollection was like, tingling in my mouth and itchy and all of those things. So as a dietitian, it was not, as a junior dietitian, it was in my mind, but it was not like, oh, this is a big problem. But I realized I had a problem. And then I traveled to Toledo. I remember it like yesterday. I think I was 24. Asked for paella, but I asked for them without shellfish, which is really stupid because I think, they just scooped out.
Mm-hmm.
And then having this massive reaction, and I react not only with, the swelling in my mouth, my heart starts beating, and I had this feeling I'm going to pass out, and my friend being next to me, and we open the map out, and she's saying on the H, going hospital, and they talk about pay the bill, and this huge panic. I did not have an adrenaline pen and all of those things. And so that was really a very conscious, very first reaction that I had. And that started my journey.
Wow.
After that, I avoided it, but it was only a couple of years when I was involved with many of my allergists that we had the skin prick testing around that, which came back positive, and the realization you need to carry an adrenaline pen with you. So that's really my journey. So for me, it's quite a new journey, if that makes sense. I am very conscious about everything that's happened to me.
Wow. And could we go back a bit? Because there's so much I want to unpick from that story. I mean, from obviously growing up in a farm in South Africa, very remote and also not an abundance of shellfish or affordable, your mum finding out she had an allergy. What was that like for you as a child to witness your mum experience a reaction in that way?
It's a good question. The truth is, I was naive. I was still a child at that stage.
Sure.
So you kind of see this reaction and this worry, and you kind of see the rushing around because remember, we're on a farm and very remote. But it did happen kind of almost. It's not to me, and it was not because my mom was not at that stage realizing what the issue was, and it took her some time. She was
Right.
thinking it was the combination of alcohol with
Mm,
shellfish,
mm.
and
Yeah.
until we picked out shellfish. And you know, just for you to also know, since then, so we have four children. Out of us, three of us are allergic, and it is really within our family, and
Wow.
also
Okay.
the nephews and nieces is something we are very aware of. We already know some of the nephews and nieces are also allergic.
And is it all
Um,
shellfish or is it different allergens? It's all shellfish.
shellfish. We are really, for those people that want to study shellfish, we are the ideal
You
family
are
to
the
do it.
ideal case study, aren't you? And when your mum had that first reaction, as you say, there wasn't a huge amount of diagnostic testing then. There wasn't a huge amount of awareness. There was this sort of narrative that it was perhaps mixed with the alcohol. And so for you, then you just carried on family life. Your mum, did she avoid shellfish at that point?
Yes, which is very easy for us to do. As I said to you,
Is it?
it's really
Okay.
it's really easy for us to do. It's become with the globalization a bit more harder,
Yeah.
but overall it's much easier there.
Because food was maybe more made from, it was raw food made from scratch. There wasn't so
Exactly.
much processed food then. You weren't buying so many packaged things with may contain. So it was,
Which is still the case, and also it's
sure.
really not a common food. It's just
Okay.
when they go on holiday, we're very careful.
Yeah. Okay. And so from that kind of early childhood, as you say, you hadn't really experienced shellfish before. And you then started your dietetic journey. And that was, how did you get into allergy? Because
Yes,
it seems
it's a
like
good
actually,
question.
I was so surprised when you said you had your first reaction, which sounded very severe, sounded like it was an anaphylactic or a
Yeah,
C-reaction.
yeah.
That was while you were already a dietitian in allergy. So
No,
no,
actually, I
you were
was
just
not yet.
junior dietitian.
Yeah,
Okay.
yeah, I was very junior. So when
Mm,
I came to the UK, I was initially just pediatrics per se, and I was very much in nutritional support, but not allergy. And you have to remember, you know, um, we're talking about 97,
okay.
98.
Okay.
Okay, so I was at St. Mary's Hospital,
Sure.
and of course, that was the era where the allergy services were starting to increase.
Yes.
And I
Mhm.
remember as appointing, I was the lead pediatric dietitian, appointing a dietitian for allergy 2 days a week, but it was not my primary domain. I'm very honest about that.
Yeah.
And if you said to me, was that the prime motivator why I
Yeah.
became an allergy dietitian? I would say to you, no.
Yeah.
And that's not driven because I didn't like allergy. It was just the naivety
Yeah.
that I
It
had
was such a new
around.
medical specialty, wasn't it?
Exactly. I was also naive around it, and
Mm.
it's clearly I understood the severity of the reaction,
Yeah.
but the implication most probably only came a little bit later when you kind of work and specialize in allergy.
Yeah. Okay. So you were then working in London. You were starting to have some shellfish. You saying you were,
Yeah, so in London was the particularly area where I started to have shellfish, but of course after
and
that
you,
big reaction
oh,
I
yes,
stopped.
of course. But initially you were just getting sort of mouth tingling. And what was that
Exactly.
like? Did you sort of just dismiss it, minimize it? Were you aware it was a slight kind of maybe oral reaction, but you weren't too concerned? You didn't think it was serious? How did you experience
Yeah.
those small
So,
reactions?
Polly, those initial, I can only put it again as being naive,
Yeah,
absolutely was the oral tingling and itching,
sure.
and I had a little bit that kind of swelling of the lips,
Yeah.
but I felt it was nothing I could not control with an antihistamine.
Sure.
It was that first anaphylactic reaction that really brought it home to me. And I want to say that that reaction has predicted a lot of my responses in future. What I mean by that is I still know now how that feeling of
Yeah.
I'm going, that kind of
Wow.
my heart is beating, and I'm kind of wanting to be in control. I'm not in control.
Wow.
That feeling I am still carrying, and I'm very honest about the fact of that I've been in situations where I've not taken any risks, but I smell shellfish or fish,
Uh-huh, uh-huh,
I imagine my mouth is tingling,
uh-huh,
and it immediately triggers that tachycardia, that heart beating.
uh-huh.
And I'm also very honest about the fact that I would migrate then to taking antihistamine.
Yeah.
I'm
Yeah.
the first one to say because
No
I'm
one's
so
safe.
stressed out
Mm.
about that reaction.
Well, it's the somatic memory of the body. It takes you instantly back into that trauma memory where you had anaphylaxis, which, as you said, you
Exactly.
had no control of your body. Would it be okay if I asked you a little bit more about that reaction?
Please.
Um, I know that for some people, trigger warning, obviously, anaphylaxis is not everyone with allergies, of course, has experienced it, but it is very scary, very traumatic.
Yeah.
And so if you do want to take a pause here, do take a pause from listening. But do you want to just talk to me from the beginning? You had ordered a paella. You were already aware. You'd made the links with the kind of oral sensations to
Yeah.
shellfish, and so you had asked not to kind of have shellfish in the paella, and then you started eating the paella. You
I
obviously
started
made.
eating. I was not, stressed out when starting. It was not, as I said, naive. I very much acknowledge that. And it was, I would say, within 5 minutes of it,
Okay.
I thought, my tongue started itching, tingly, and small little signs.
Okay.
And I, again, naive, I did not stop and, continue chatting to my friend and so
Yeah.
on. Distraction, the distraction, anybody that has gone through anaphylaxis and is aware of that, distraction is a great technique if you're starting to feel and you think it's in your head a little bit
Yes.
to kind of get yourself. So I said to her, talk to me, let's kind of see. And I think it was when my heart started beating, that kind of beating, sitting down. So there was no obvious reason why my heart
Yeah. You
should
didn't
have
suddenly go on
started
a run
beating.
mid-meal.
Exactly.
Mhm.
And it was then that awareness. So that's when your medical training kind of comes in,
Mm.
where rightly or wrongly, it was saying to me, this is not normal.
Yeah.
It might be that somebody that did not have a medical training might be saying, it's a bit weird that my heart is beating. I
Sure.
immediately then put two and two together. So I also have to acknowledge it could be that the reaction would have not been so bad if I did not realize exactly what was going on.
Mhm.
And it was then this realization, I'm not at home. I do not have treatment with me. And I can't speak the language.
Very terrifying. That's a huge fear. Massive
Exactly.
fear. It's
And
lots of
this
anxiety.
miscommunication, we saying age, hospital, hospital, hospital.
Mhm.
I think also now, I don't think you will go through that because I think the awareness of allergy
Yeah.
is higher.
Yeah.
But I think it was this, and I think many of my parents and patients that I talk to is this environment, and that's common that you have your reaction in an environment that is not often your home environment. And
Yes.
so it's whenever we talk about risk taking, that's always where I talk about my personal experience. So I think putting all of that together, that's what created this, and me kind of thinking back to that time. Whenever I'm in a situation where I'm going, oh, my mouth is itching, it goes back exactly like you're saying to that. And I think often my heart is starting to beat just
It
because
it will do,
of that.
absolutely. And that will be an anxiety physiological response.
Exactly.
Just so that we can end the story and have a happy ending here, you're leaving us in the middle. So running through your mind is, I don't speak the language, there isn't a hospital nearby, I know that this is now a serious reaction. This isn't the same as my
Yeah.
previous ones, which have been more oral symptoms. And it sounds like you were very aware that you needed adrenaline.
Yeah. So at that stage, so happy ending, we did get help and support.
Yeah.
I did get managed very appropriately, very grateful for that.
So did you
Uh,
get blue lighted to hospital? Did you get an ambulance?
no, in fact, it wasn't like that. So first of all, I chewed antihistamine. I think I overdosed myself.
Okay. Okay. Yeah.
So that's the first thing is.
Yeah.
And again, I know very irrational. I just want to say to anybody, what I'm saying now is not the general advice. When chewing antihistamine, I just thought in my mouth, I think I have this oral reaction. Let me just
Yes.
chew it. So that
Spread it
was
all
my
around the mouth. Yeah.
exactly all of
Yeah.
those irrelevant. But I knew because they couldn't understand me that I was in a very nice hotel and I had a doctor within that hotel. And, I knew all of the services that they had and had then the
Okay.
appropriate, all of the appropriate treatment there. But
Sure.
truthfully, by the time that I got to the hotel, doctor and all of those, I was already starting to feel better.
Okay.
And so it was that kind of combination of help is on the way, and so I did get all of the correct treatment when I was there, but I did not need to go to well, it was stupid now thinking about it. I should have gone to the
But at
hospital,
the time
but
you did, well, you were in a foreign
no.
country, you felt like safer in the hotel, there was the doctor that you kind of felt comfortable with, and yeah. And when
And
you saw him, did he administer an adrenaline device? Did
yeah,
you do it? How did it,
yeah,
what was that?
and that was absolutely fine. That's when your medical kind of uh
Right. Interesting.
thinking comes in. I was comfortable with that. I want to say by the outset, I don't have needle phobia or
Okay.
anything
So you
like
were
that,
just
which is
grateful
very,
that he had the device and you were grateful that,
yeah, but that was not my device. Okay,
no,
so that were,
I know.
okay, that I just want to say, but
Mm,
I want to, maybe we can touch on that in terms of also how you react when you have an anaphylactic or when you think you're having an
mm,
anaphylactic reaction.
mm.
And you can lead the discussion around it because I can tell you anybody that says for somebody that has a reaction um, that you think logically, was certainly for me, it doesn't work. Even with medical training, you do not think in that situation
Was it
logically.
anxiety? I mean, obviously the physical symptoms from the allergy reaction themselves, you've got a huge amount of physiological changes happening in your body. And then on top of that, naturally, you're going to feel really scared. And when we feel scared, on top of also being medically unwell, your right side and your left side of your brain is going to be disconnected. So people might think they're being really, really logical and rational, but it's impossible without that integration. So as you say, for you, you kind of rubbing it round your mouth, you were trying to, you
All
know,
of those
just,
irrational things, absolutely.
but in your mind, which was a very scared mind, you were doing what you thought was the best thing to do.
Yeah, yeah,
What,
yeah.
looking back on it, how do you make sense of that, or what do you?
I look back on it, it's almost like I'm looking back not on myself, if
Yeah,
that makes sense. I look at it from a distance to a person saying, how was that possible? How stupid am I?
mm,
And Polly, I've had other reactions, and
right,
I can tell you, I've done very stupid things,
yeah.
very, very stupid things, and I'm very happy and open to talk because I
You
have
will,
had
let's together. Yeah,
yeah, as a specialist dietitian specialist
yeah.
lecturing at an allergy congress in China with a colleague that we both know. So I had an allergist to my side,
Yeah,
okay, and a gastroenterologist, allergists all in the room. We had our dinner prior to a flight back to the UK. What did I do? We sat and we ate, and my adrenaline auto-injector, my all of my emergency medication was in the concierge.
right.
So everybody knows, again, we're in a country that I don't know, but I feel very comfortable. I have all of these people that have translated, and whenever I travel to Asia, I kind of go, I'm a vegetarian, absolutely vegetarian, so
Sure.
to be as safe as possible. First bite of a spring roll. that prawn looked at me on the bite of the spring roll. And, it's then that exactly that previous reaction comes back. I realized I don't have my adrenaline pen with me at that stage. I grab the allergist next to me and I'm saying to him, I am starting to react.
Yeah.
Now, you would have thought my brain that is trained would say, you're going to an anaphylaxis, you do not have it with you, you sit put, you tell them where is all of your adrenaline pen, get it, and you lie down, which is absolutely right way. No, my brain goes, you are in fight and flight. I start running to run towards the concierge. Didn't tell, I just went, I am starting to react, pushed my chair back, started to run. They start looking for me in the toilets, thinking I'm going to make myself sick and maybe I've collapsed. So they go through all of the toilets and I'm at the concierge
Sure.
getting my adrenaline pen there.
Wow. Wow.
And I know that that is used by this specific allergist as an example of how you should not react. But I'm the dietitian. I know you should not, but I can tell you at that stage, your brain does things to you that you cannot control.
I I I hear you. I understand that there is a perfect way of dealing with things, but I also think you're being a bit mean to yourself. You were aware that you wanted to do it as timely as possible, and you knew exactly where it was. And I imagine that part of you also thought, if I sit here trying to explain exactly where it is in the concierge and what pocket and where that might take too long. And you are in that fight or flight, that real threat mode, and you wanted to do action. The idea of just sitting and lying and waiting for someone to find your pen, I think that actually, you need to be kinder to yourself in that situation, that you went there and you obviously got the EpiPen or the adrenaline.
So all of it, yes, all of it worked out. But, I was told off, you can imagine, being at an allergy congress. So yes, I am harsh on myself, but I should have, in theory, known better. But yeah, it happened.
But I do think that with both the examples you've given from nothing, you're calling it stupid. I think that's really mean to yourself. That is, it's not at all. Both of those ways, they might not have been traditionally the absolute rule book thing to do, but we're human. And when something really scary happens to us, as I say, our hemispheres do become disconnected. You are in fight or flight, and you just need to act, right? That's your coping skill. Your coping skill is to drive, to do, to get, you want to get the treatment and the medication. And I think that it's almost a curse that that you are professional in that, because you then have such high expectations of how you manage it. All things considered, you took yourself to the doctor, that you had the awareness in the first reaction that you felt comfortable in the hotel. You were aware that there was a doctor there. You're obviously aware that he would have, an adrenaline device. So that seems incredibly, like a very good and compassionate thing to do for yourself. And again, in the conference, you didn't just run off. You did let the allergist know. I mean, the idea of having foresight to know where, there's a little bit of mind blindness there, but to be fair, you were experiencing anaphylaxis and you went to the adrenaline device.
Yes.
So how long a gap was that between the first reaction and the second, and how had that changed?
No, that's a couple of years,
Right.
Polly. I want to say it's something like, so my first severe reaction was around 98, and this one was, I would say, 20 years later, 2008. They've always been, and I think a lot of us can talk about near misses and so on before that and so on. And I had a near miss last week Friday also, where we went for Indonesian, and it was my mistake. I could smell it, and then I took a bite, and then immediately smelled that we phoned up and there was shrimp paste. So I have frequently, but I'm now much more careful. And I think it's I don't have very frequent episodes like that. It's many years. So
20 years apart is
exactly.
And you obviously had a very different allergy management and risk perception and risk assessment.
Exactly.
How did it change? If we go back to the first episode, following, then you would have got a diagnosis of you already had one, but when did you get a more formal diagnosis and get administered the adrenaline device? Could you tell me about that?
So no, so it's a very good question. This is where healthcare professionals are doing not the favor to themselves. So my formal diagnosis came with, oh, these are my colleagues in the allergy department. Can you quickly do, please, some skin prick testing? And so, by the way, and so they did shellfish, but they also did cockroaches, and that's an important one to do because that
Interesting.
was because crustaceans, I know it's disgusting, but
Yeah.
crustacean, there's that cross reaction. And we are in a environment now where food sources are sourced that are more environmentally friendly, and you will start seeing more and more cockroach kind of foods coming. And so they tested me to all of, and mealworm is also a cross-reacting one.
Okay.
So I
Okay.
was tested. So, and it was then within the allergy, my colleagues that went, oh yeah, Roseanne, you have that. So
Mm.
it's kind of like
And to
that.
cockroaches and to mealworms.
Yeah, mealworms as well. So I react to all of them. What
Okay.
I don't react to is mollusks,
Okay.
but I can tell you now that I'm very careful now. You asked me what has changed.
Yeah.
As I've got that diagnosis, and although I'm mollusks negative, I'm very careful to have like mollusks. So that's the mul. So any of those type of things like so I avoid all of the categories, not only crustaceans, but mollusks as well,
Mhm.
because I'm concerned about cross reaction.
Sure.
Most of the time, it's not, I'm sure I could contain it, but that's where my anxiety goes. And
Okay.
to say, I'm not prepared to take that risk because I think I've too often been in an environment where I'm thinking I'm okay, I'm going to do that and have a mollusk, but my heart just starts beating
Sure.
because of that environment.
And I think that, everyone has got to have their own individual boundaries and their own individual ways of managing their allergy. And I think that that sounds like for you, that's a good enough balance between not being overly restrictive, but at the same time,
Yeah.
they're often, in the same menu, the same sort of dish. So I think that sounds like that for you
Yeah.
has been just a life decision, and that's your allergy management. I mean, typically children get diagnosed with allergies, and or people get diagnosed when they're a lot younger. So initially the management is about how the parents support the child and how they at first are completely responsible for them and control the environments. But for you were older, so how did that affect? So did you kind of let your mum, your parents know? Did you let your siblings know? Who were you living with?
Yeah.
How did you kind of communicate and advocate for yourself? And
Yeah.
did that feel quite scary as a, sort of living independently at the time, or you felt like you had
Uh,
responsibility for yourself?
it's a
You
great
had all that
question.
training from childhood to transition. What was that like?
Yeah. So first of all, for shellfish, it's very common to be a later presenting
Right. Yeah.
allergy for those people that are listening.
Uh-huh.
But
Mm.
I mourned shellfish. I want to say it first.
Mm.
I mourned it because, I still would say to you that smell of shellfish on a barbecue with garlic butter and all of those stuff. So I want to say to you that was a mourning process to kind of going, I can't do that.
Yeah.
It took some time, and I would say too, because I lecture a lot in terms of my social environments with lecturing. So A5, so going to Spain, where my initial reaction was I was initially stressful and all of those. So it started with, the communication to friends and family, and also loved ones that are close and with you. So my husband, in terms of for him, he comes from a family where, the domain of allergy is new, nothing.
Yeah.
So for him also kind of to train him to saying, look, you may need to take responsibility of the adrenaline pen. So I do, I call it an annual training with him. And I have here all of my adrenaline pens on my
Okay.
desk. So,
Okay.
so, my trainer pen. So what we do every year is he gets a training session. We take my adrenaline pens that are expired and, we take banana and all of that. It's not the same, but he needs to feel the click and
Sure.
all of that.
Sure.
So it's that is really important.
So you were married at the time when you had your first reaction, were you?
No,
No.
no, he
Okay.
kind of married into,
Married
into
into
the
the
situation.
allergy
Married into,
family. Yeah.
exactly. But it's also around me beforehand. So I have always my emergency medication, and that was after my reactions. that's the biggest lesson
Mm.
that I've learned. No epi, no eti. You
Yeah.
know, it's that I don't have food if I don't have it around. It's
Yeah.
really that management. How do I make sure? And that is everybody around me. Um, no, but I know that is a difficult one with a child, that you have this physicality of having your adrenaline pen with you, because that's in fact my first comfort blanket.
Sure.
But it's the sharing of responsibilities. So if you said to me, how do I share that? It is in every environment that I go, who's around me?
Hmm.
Who do I trust,
Yes.
around me? Who do I know that will not kind of get freaked out by it? Now,
Yes.
first of all, I'm very lucky that the vast majority of friends that I have some kind of medical training.
Sure. Yeah.
That is not a privilege that many of our
Hmm.
families have. But I always kind of make sure, because that's the mistakes that I've made before, is not saying, where is my adrenaline pen? So I always kind of go, people next to me, around me, everywhere, kind
Yeah.
of going, can I just say, in my bag, this is where it is, that this is the type of adrenaline pen. So you see around me, I have two different ones around me. So this is a Jax, this is the more universal one. So make sure that they know what I've got, what is the side that comes off, what is the side
Like a
that is
mini
injected.
training session for people, especially if you're kind of staying with them or you're in a food environment with them.
Yeah.
Yeah.
But can I tell you that for my husband, it's not a comfortable situation.
Okay.
The fact that he may need to administer, so I can so identify with parents having to do that to their own child.
Yeah.
So that is where my empathy for, and it's really been positive for families. And
Mhm.
also this question that you said around, it is about risk management.
Yeah.
I don't think we can say to anybody there's zero risk.
Hmm.
And I think that's the frightening bit for anybody and for me as well. So it's taken a couple of years, to kind of I'm going to Asia, many of the countries for shellfish. That's a really,
That, yeah, for many people that don't have international travel in their careers, or that's something that they would probably avoid. A lot of majority of
exactly,
sufferers would, especially with shellfish or nuts, that wouldn't be a destination of choice. So
exactly.
that's one that you tell me a bit more about what's helped you, because I think a lot of people will be listening to this, and obviously, it sounds like from the two reactions, both have come slightly from a place of naivety, in the sense that they've not been ideal allergy management. So
No,
the first one, you kind of wholeheartedly recognize that that isn't, appropriate way of ordering food if you have a shellfish allergy.
yeah,
Not to be critical to you at all. You were
no,
naive to it,
absolutely.
and, you did your best. And I think that you're actually really harsh on yourself and having many shoulds and, rule book kind of expectations of how you should deal with these things, but you're human and you're in a state of shock. So totally fair enough. But I think what it sounds for me is that you've recognized from those two severe reactions, that's really changed your allergy management, which has then helped you with your confidence moving forward to continue to travel, to
Yeah,
continue to eat out, because you recognize that there was a clear thing that you didn't do in those two situations.
yeah,
For example, you didn't have the adrenaline device on you on the second, and the first one,
yeah,
obviously, there was just not enough awareness of the allergy. So what's helps you? A lot of people will be listening to this, and they'd be fascinated to know what helps you to be able to go to Asia and how you do manage the
yeah,
allergies.
yeah. No, it's a great question. So the first thing is, familiarize myself with the foods, the local foods before I go. So I kind
Yeah.
of go, so if I, for example, go um, to Indonesia or Thailand, I kind of go that hidden sources shrimp paste is a salt kind of, it's like almost like anchovies in many of the countries. So it's those, I make sure that I know what are the hidden sources, what do I need to look out for. The second thing and most important thing is I make sure that I have a translation card. So you can get them downloaded for the specific language and a chef's card. There are some languages that you don't necessarily get that. And so what I've often done, so I've done something, and then I go to a hotel and saying, can you just read this for me?
Mhm.
What does it say to you?
Great. So you're really
So
double.
that I may, because, it has symbols in there that I can't check.
Yeah.
Now with AI, of course, it is a little bit easier to check, is that correct? So I make sure that I've got it in writing somewhere. Um, And if it's for professional reasons, for anybody that deals with me for Congress, I email them beforehand to say,
Yeah.
can I just ask, I'm this allergy, that those are my dietary requirements. And then I go plus plus. What I mean by that is I avoid then a restaurant that would just have fish and shellfish.
Yeah.
Okay. So although I can have fish, I kind of go, okay, if I go to a place I look at the menu, and if I just see, my goodness, this is fish and shellfish and no other vegetarian, no tofu alternatives and those, I will then make that risk. It is for me also for my head that risk, because it might be that the contamination risk is not very high, but it's still, I kind of,
So understandably, you then think in your mind what the kitchen looks like, and it doesn't feel very reassuring.
exactly, exactly. And that the other aspect is I avoid any kind of shared food. So, any of those places where you have lots of shared plates, I don't do that when I travel at all.
Yeah.
So buffet style,
Yeah.
not at all. So I
And what
really
about
avoid
when
that.
you go into a restaurant and say it's got lots of vegetarian options, maybe no shellfish at all, just fish, but you get that feeling that they don't properly understand?
Yeah. So
What do you do with that niggle?
I still, and I have had that they say vegetarian, vegetarian, but that whiff of fishy kindness
Okay.
comes through. So I've learned my lesson there. So I still say to them, and I ask them to say, is there shrimp paste? Is there oyster sauce? So in theory, oyster sauce, as you know, because mollusk is not an issue. But I still, as I go plus plus
Yeah.
when I travel.
Yeah.
So I still do that and ask them.
Yeah. So
But
you
only
don't
one thing I
stop
don't do,
feel 100%.
um, at some point, you have to also let go
Yeah.
and trust.
Yeah.
And that's a discussion I often have with my family. So I make sure I choose a restaurant. I make sure when I travel, I know more or less. I give them my chef card, my translation card. And as I order, I make sure and ask them about. And then the food comes. And unless I have that feeling, because you can get into a situation, certainly for me,
Mm.
where asking and re-asking and asking, you find, first of all, they get annoyed, but also I don't think for me in my head
Well, yeah, because
that
what are you thinking about when you're asking these recurrent, repeated questions and repeatedly asking for reassurance? You're thinking about the allergy, right? So
exactly.
so all you're then focusing on is, does this have my allergen? Will I have a reaction?
Yeah.
My lips. So I think it sounds like you have very good ways of managing in the sense that you do your best allergy management. You do plus plus, and then when you've done plus plus, you then let it go and you enjoy your meal.
And I have my adrenaline pen, all of
And then
those.
you know in your back of your mind if there is something which is out of your control because you've done all the control steps, you've done the risk assessment, you've done the superb allergy management, you then have to live your life, and that's the point where you then say, I'm going to enjoy my meal. Yeah.
Exactly. But I know also that's a privilege to knowledge, to kind of going, okay, now I need to step back. I think the other thing that I also am very mindful of is, which I didn't mention, I
Mm,
do make sure that I know where emergency services are. So
yeah,
if I'm, for
especially if you're
example,
traveling. Yeah.
yeah.
Mm,
So when I'm traveling, it's in the bigger cities that I would kind of in restaurants. But when I'm in smaller cities and I don't know exactly, I'm then kind of really going saying, okay,
mhm,
I might not be that adventurous. So somebody else might say, we'll go to a market and we'll
mhm,
just pick a food from a market
mhm.
where they just mix and have.
Yeah.
Then that I would not then do.
And if we then think about how you manage it more day to day now, I'd be really interested to just hear sort of when you're not traveling, when it's just the day to day management, how do you feel about that kind of, does the reaction pop into your head, those previous two severe reactions, does that come into your head much? Do you feel like it sounds like you feel quite comfortable advocating for yourself in terms of you're happy training other people? Because a lot of people that I see with allergies, that's a huge anxiety for them, being a burden or being a nuisance, which is not that's not how people should feel. There's, it's not their fault. No one decides or chooses to have allergies, and everyone is absolutely equal. But for a lot of people, unfortunately, that does affect their self-esteem and advocacy. But it sounds like you cope quite well with that. What's the main thing? Like, what do you feel you do well day to day? And maybe also, what do you feel like is still a bit of a worry or an anxiety or something that you kind of have to cope with?
Yeah, no, it's a good question. So I think those things that I do well
Mm.
is having always my emergency
Mhm.
medication around me, informing people around me. I feel very comfortable with that. I have no
That's
problem
great.
to inform people. Uh, so I think that the pre-preparation,
Mhm.
my environment, what I choose, all of those type of things, I think I do well. And I think I do it so well
Mhm.
that for me, if you said to me, does it impact on your life? Honestly, Polly, for me, it's part of me. I
Mm.
don't feel that as an inhibiting factor for
Mhm.
me anymore.
Mhm.
So I lead my life and I work around my allergy. So I think those type of things I do really well. The things that I don't do that well is possibly I might put I'm going so around, I'm feeling so well, and I tell
Mhm.
my people, friends around me that maybe I don't take into account the stress I'm putting on those that are not healthcare professionals. It was Chinese New Year 2 weeks ago,
Mhm.
and friends of ours invited us for, one of those Chinese, compote pots where you boil everything together.
Mhm.
And I didn't realize until I got there. So they were asking about my allergy. They were so stressed out.
Oh,
They
yeah.
asked me then to read everything. They got the
Mhm.
bouillon and so on. So I
Mhm.
think that most probably I don't do well enough. That understanding that friends who are not in the healthcare professional domain,
Mhm. Mhm.
how stressful it could be to cater for me.
Mhm. Mhm.
So I think it's easy, but it's not.
And allergy isn't just an individual kind of condition. It affects. It's such a, and I think that's one of the things that causes such difficulties with mental health around it, because it, part of the condition is that you need to trust other people. So it's inherently dependent on other people, whether they can cook the food that's safe for you. But you're right, that's an interesting perspective to think about, actually, the impact that other people feel and how they kind of experience trying to keep you safe. And I also think that you're possibly maybe putting too much mental strength on your healthcare colleagues too. I imagine that they also experience a lot of anxiety and stress to try and keep you safe,
Yeah, and I mean that is, I know we've got a lot of that is a different situation because I have been involved, at the European Academy
Mm.
Congress 2 years ago. Phone call, Roseanne, where are you? I'm like, why, what is now? We need your adrenaline pen. There's a healthcare professional that has got severe anaphylaxis. We've already given 2 adrenaline pens. Can we have your adrenaline pens?
Okay.
So then give my adrenaline pens. Then I go and now I'm on one leg. I
Right.
have one adrenaline pen. Dinner, I've got one adrenaline pen, not two. Go to a colleague who I know has got a fish allergy.
Okay.
My friend, have you got your adrenaline pen? Just want to make sure between you and me that we've got enough adrenaline pens. We are in an area. He goes to me, oh, Roseanne, I've got none. I was relying on you.
Oh, wow.
An allergist.
Okay.
So
I guess that's both reassuring for people and then also terrifying. I'm not
yeah,
sure how to
but
take
Polly, the other thing I wanted to also say, and I want to say this because I want to be honest to everybody around. So one thing that has not left me, and I said that throughout, I still, when we go out,
that.
even in safe environments,
Yeah.
would have situations where I think, oh, is this not? My heart is starting to
Uh-huh.
beat, and
Uh-huh.
I can tell you where everything is absolutely fine.
Yeah.
And I can absolutely tell you in those situations, I would, it's very likely that I don't need anything. I would still take an antihistamine for my head and I would say to people around me, talk to me, just talk
Yes.
to me,
Distracts me.
distract me, take me away. So that is something I still very much struggle. And I always say to parents when they go through that and saying, we're looking at somebody. and making now, like my child, is he okay? Is it not okay? I see to myself.
Yeah.
I'm super vigilant, and that is something I don't know if I'll ever get across,
Mm-hmm.
but that is an area I still struggle with.
And I think that everyone listening to this will be anyone with allergies, or as a parent with allergies, with a child with allergies, they will be, wholeheartedly nodding along, because the kind of that fine line between, is this allergy reaction or is this an anxiety reaction, is one that it's incredibly difficult to know the difference, because the symptoms are so similar, especially at the beginning. Um, and that's why I think you have excellent, allergy management. And you do typically then, after you've done all of the plus, you then focus on distraction and enjoying the meal and letting it go. But of course, there's going to be times where you're put back into that traumatic sort of anaphylactic
Yeah.
situation again, and the somatic memory of the body will manifest the same symptoms. And that's the body talking, saying it's stressed and it's anxious and it remembers. But, I think you've already given some great advice and great tips for people in those situations. Obviously, you do take the antihistamines, which is very individual, is very personal, and maybe there are some oral symptoms there at the beginning, but then you say to yourself, you distract yourself. I think that's the key thing. You kind of tell other people you're feeling anxious, which is great, because that means that you're kind of asking support from other people. It's not something you should suffer alone. And it sounds like that's not been something that has been impacting on your quality of life too much. There have been discrete times where that's happened, but overall you have managed it and feel confident with it. What?
No, and I'm grateful for that.
Wow, you work hard at that. It's an effort. It's hard work to be able to cope with that stress, and to tell yourself, you obviously have good positive self-talk in those situations too, like, I know that this is, I need to be distracted now, because it's much easier to lean into the fear,
Yes.
isn't it? You have to
Yeah.
consciously make a really big effort and be brave. Is there anything else that you can tell listeners about that? Because I think, from listening to your story, you have been incredibly brave in terms of your life choices, your career, travel. You've overcome 2 severe reactions. And of course, you have a human level of anxiety around it, which is very normal and understandable. But is there anything else that you think has helped?
I think what has certainly helped, and I think that's a professional help. For
Mm.
me, the way my brain is wired is scientific, and what has helped, I know for not a lot of people, it's reading more about the situation. So I've gone really into reading. For some people, it's triggering.
Yeah.
For me, it has been reassuring. So, and I think you know better than me when kind of can it be reassuring to understand the type of allergy, which is the allergen,
Mhm.
and all of those things. That has been for me
Mhm.
helpful,
Mhm. Mhm.
but I think it's not for everybody. To know more does not mean it helps.
Yeah, it sounds like for you, the scientific aspect, the kind of research, the problem solving coping style has helpful, because when you talk about severe reaction, and when you talk about when you've done your plus, you let it go, I think that a lot of your confidence comes from the fact that you have trust in the medication,
Yeah,
and you have
I
trust.
know the data.
Exactly. So you're thinking from that. And I think that's an important point, because I think sometimes that research then does kind of tilter over to over researching, over reassurance seeking, overthinking about it,
Yeah,
and then your whole life and day becomes allergies and allergy management, because there's only so much research one needs to do. And if you find yourself on forums, and if you find yourself sort of constantly reading the sort of bad news stories, you're going to get a massive bias about the data and
yeah.
risk.
Yeah, and Polly, the other thing that is important, and that's not only important, it was not only something for me, but it was for our whole family,
Yeah.
and I want to acknowledge that having a shellfish allergy in a European perspective is not, it's not the severest and hardest, because it's only when I go to Asia that it becomes really, really hard in certain places. But it's that decision to say, I have this anaphylaxis, but the anaphylaxis does not define me.
Mm.
So I'm going to lead my life that it's not that anaphylaxis dictates where I'm traveling, what I'm doing.
Mhm.
It's going to that actually what I'm doing is going to work around
Mm.
having this anaphylaxis to shellfish. And that decision, making that
Mm.
mind shift of saying, right, what am I going to do to maintain my quality of life?
Mhm.
That I can still do the things, I'm not going to be stupid, but I can still do the things that I want to do. And acknowledging that there's never a zero risk situation.
Yeah.
But the risk is ameliorated by the fact I have my emergency plan. I have all of that with me. And that mind shift, and that is a mind shift that happened really early on
Okay.
for me.
Thank you. And I finally just wanted to ask you how you've said a little bit about how it's impacted you as a pediatric dietitian, but could you just tell me a little bit more about how you think it's sort of influenced the way you work and how you support your patients?
Yes, I think it has a positive and a negative impact, and let me tell you why. So the positive impact from my side is I have a lot of empathy.
Mm.
I can absolutely feel what parents are feeling, my adolescents also. I
Mm.
do get the questions from, have you had an anaphylactic reaction? How does it feel? So I can do that. The negative is that it's been part of my life for so many years that I often forget that journey that I've gone through.
Mm.
And my journey was as an adult. It's not as a child.
Mm.
So so I need to often go back and reflect and saying, okay, outside of having empathy, is my life is now so, I know about risk. I ask about restaurants and so on. It's automated. But if you're newly diagnosed, and from the parents to a newly diagnosed child with peanut allergy, doing the phoning of the restaurant, it's new. So I often have to step back and not kind of going for and understand this is a new journey. It's not, doesn't come as natural as it comes from me.
Sure, sure.
So I think it has both sides, and I think that particularly becomes very obvious when I have discussions with parents around trace labeling.
Mhm.
It's because in my head, as you said, I know the research in terms of risk and I know what the labeling law says and so on. But for a lot of parents that start the journey, having something saying may contain traces of nuts, in my head, kind of going, well, might not be actually a real risk because it might not be tested and all of that. But those are not cognitive steps that
Yeah.
any parent has gone through. I've gone through them in my mind, but not somebody else. So
Mhm.
that's, I think, where possibly the impact is negative.
Sure, everyone has a different way of coping, and you're aware that yours is also your personal way of coping, and you don't want to put that onto other families, and you're aware that there's difference. I think it's interesting because you work with children, because I see people across the lifespan and a number of adult patients with shellfish allergies, and I think that they would also love to hear this story. So
Yeah,
there are some people that can listen to this, but
yeah.
the main fears that the adults have is because it was sort of for them seemingly out of the blue and it came in their adult life, then there's a lot of fears of what if they suddenly develop another allergy to something else and that they haven't had that experience. What could you say for those adults with allergies that they've developed later in life? And how did you find ways of coping with the fear that suddenly you might become allergic to something else?
Which for me was initially because I was thinking around mollusks and things like that. I mean, I'm cutting them out, but there was that kind of going, what if I have a anaphylactic reaction? I lecture in Belgium a
Mm.
lot, and you can imagine that having mussels there is a very common thing to have. So my advice there would be, I think, having an allergist, somebody that knows about allergy, because it's not worth just avoiding without the knowledge. Is it really worthwhile avoiding? That does not mean, your emotional brain does not take over. That somatic size, I've got a reaction. Maybe I'll have a reaction. So I think understanding what reaction you've got and having yourself tested, I think that's an important step. And, I lectured on Wednesday
Mm.
to my students here. And I always try to find, it was around allergies, and I wanted to find out in my class how many of the master students had an allergy. So one said to me, he's got a hazelnut allergy. And I said to him, have you been tested? And he's like, no. And I said, have you got an adrenaline pen? No. Have you had severe reactions? Yes. So you can see, and he explained how stressed he is. So for me, the first question is, so he's avoiding all nuts,
Uh-huh.
is saying, go and have that properly explored. Don't just go and say, because of one thing, I'm going to react.
Okay.
Then once you have the knowledge,
Mhm.
then the question is, what are the steps? Talking to you, for example, would be a step
Mhm.
to be able to normalize and saying, I am going to try mollusks
Yeah.
and I'm going to do that.
Mhm.
But you shouldn't be doing it without having the knowledge where you are.
That's great.
Then the next step is, if you're too nervous,
Mhm.
I think then it's worth saying, okay, is it important in my life? So for me,
Yeah.
mollusks are not that important
Mhm.
in my life.
Mhm.
So I could go otherwise than saying I've got enough context to say I'd like to be challenged.
Mhm. Mhm.
So if it's really important for you, if you said to me,
Yeah.
I'd want to do that. And that's what I say to parents, and saying, if that's really important for you, go then have a supervised
Mm.
feed. But I think tripling around, is it not? I think it's much better facing it head on. That certainly helped me. And saying, okay, let's go and think, is it a real allergy? Yes or no? If
Mhm.
it's no, I'm negative. What do you need to get to a point where you can introduce those foods that you're fearful of that you may develop a reaction? But avoidance is not going to help you contain
Mhm.
a reaction. And particularly in pediatrics, you and me both know,
Yeah.
avoidance is not going to help.
Thank you so much. Thank you so much for sharing your story today. It's been a really, really great conversation. I think, people will find it incredibly helpful for themselves and for their children or for anyone in their family, to be able to hear someone talk so openly about having severe reactions, to hear your diagnostic journey. And of course, as ever, it reminds us it's very much not just a medical condition, that it has huge impact psychologically, emotionally as well. And it's not just isolated, it's not just ourselves, it impacts, the wider family and our friends. So this has been a really, really great conversation. Thank you so much, Roseanne. And I
Thank you from
will
my side too.
see you again soon.
Thank you very much.
Okay. That was such a thoughtful and honest conversation with Roseanne, and I'm so grateful for her to share both her professional insight and her personal experience of living with a food allergy. If you found this episode helpful, please do share it with someone else who might benefit from listening, both through my Instagram account, on the YouTube channel, and please do join me next time on Living with Allergies.